Welcome, everyone. Thank you for joining us today for today's webinar. My name is Angela Ruckert, and I'm the CEO at Forte Elements. Forte Elements is a science and research-based company with condition-specific nutritional supplements. And our topic today is concussions and improving brain resilience. And it'll be presented by Dr. Kirt Kimball. And we're very excited to have Dr. Kimball with us today. It's a rare opportunity to have him here answering questions live. To give you a little bit of information about Dr. Kimball, he is a native of Southern California, and he obtained his undergraduate training at BYU and USC, and then received a medical degree at UCLA. Dr. Kimball established himself as an orthopedic surgeon in Santa Barbara, California, where he was a team physician to UCSB and traveled for many years with the USC ski team and was a medical officer for the LA Summer Olympics. He had developed extensive experience treating high-demand athletes. In 1996, Dr. Kimball moved to Utah and became the team physician to BYU and limited his practice to knee and shoulder conditions. He recognized the value of applied focused nutrition in the accelerated recovery of athletes, and he expanded his knowledge to help patients apply focused nutrition to a variety of health conditions by creating Forte Elements, where he functions as chief medical officer. And in addition, Dr. Kimball maintains a busy surgical practice in Provo, Utah. Dr. Kimball and his wife, Julie, are parents to 10 children and 39 grandchildren. All 10 children have graduated from Brigham Young University, and his children include 5 physicians, a nurse practitioner, and a registered dietitian. For hobbies, he enjoys snow skiing, hunting, water sports, and watching football, basketball, volleyball, and soccer from the sidelines. We're very excited to have him. So during the presentation today, if you have any questions, please type them into the question box in your GoToWebinar control panel, and we'll also have time for questions at the end. So now we're going to turn the time over to Dr. Kirt Kimball.
Thank you. Very happy to be here and talk about a problem that all of us are kind of focused on right now, whether we would like to or not. Main topic of discussion in just about every sport, and certainly every collision-related sport, is the issue of brain injury, TBI, MTBI, concussions, and a pretty complex series of terminologies that not everybody that talks about them really thoroughly understands. What we do know is that it's a big deal, and that acute and chronic brain injuries go well beyond just sports. More than 3 million TBIs occur annually. That's just in the US. Millions of emergency room visits, a lot of deaths, and a lot of hospitalizations are related to brain injury. And what's interesting is that the frequency of concussions and brain injury in sport is growing. Concern about it is growing. Focus on it is expanded. Of course, a lot of this came from the focus on TBI in the NFL, but it's estimated that 3.8 million sports and recreation related concussions occur in the US every year. The CDC has defined this issue an epidemic. And in 2016, many of you may be aware, a federal judge granted a preliminary approval of a $75 million settlement of a class action issue regarding concussions against the NCAA. So it's not just the NFL. It really impacts every level of sport. In my own program here at BYU, this is Tom Homo, our athletic director. He played Division I football. He played in the NFL. He coached in the Pac-12 for a while, and now he's the athletic director at Brigham Young University. And he's very close to this issue because of his concern, not only from his own experience in football, but also those of our athletes. And in a meeting discussing these issues not too long ago, his take-home direction to us was, we have to do something, and I'm sure many of you share that same concern. And if we're going to do something, what are we going to do? We know that concussions are on the rise, and when you drill down on the data related to the frequency of concussion relative to sports participation, we know that the number of athletes participating in sports is going down relatively across the country. And at the same time, the incidence of concussion is going up. So we know the problem's not going away. If anything, it's getting worse. We have a lot of data from the NC2A. I'm sure many of you are familiar with that. Probably the important thing for me is the fact that of all the concussions recorded in NC2A data, only about a third of them occur in football. Another third occur in women's sports. Many of those are soccer related, but it happens, of course, in gymnastics and cheer and baseball and basketball. And it's not just a football related issue, even though the initial focus, of course, was on the NFL. So a lot of investment has occurred in research, protective equipment, education, and awareness. Yet, in spite of what has been done so far, the risk and the frequency of concussion in sports is actually going up. So what about equipment? The NFL has contributed a lot of money to equipment companies to develop better protective equipment. But a recent study has demonstrated that the use of a helmet reduces the risk of TBI or traumatic brain injury by perhaps only 20% and maybe even less than that. Hard helmets, as in football and lacrosse and hockey, do reduce the incidence of skull fracture. That's great. And laceration, but unfortunately doesn't really do much in terms of reducing the incidence of concussion. And that's led to the position statement recently released by the American Medical Society for Sports Medicine. So putting on a helmet, at least in its current technology, doesn't do much in terms of reducing the incidence of actual injury to the brain. So when we look at the research relative to brain injury, an important observation was made recently by Morley and Seneff in a study where they looked at the reasons behind why TBI and brain injury may be increasing when really with all the efforts that have occurred, one would think it would be on the decline. And in fact, they identified a condition or a description really they called diminished brain resilience syndrome. And in essence, they defined the fact that brains today seem to be more sensitive to injury than they were a mere 40 or 50 years ago. And when we look at the causes of this diminished brain resilience, it seems to boil down into three different areas, at least two of which are related to diet. Number one, the American diet has moved away from omega-3 fatty acids, and we'll talk about that a little more in a second. We are exposed more to environmental toxins and antibiotics, and those seem to play a role. And generally speaking, across the board, our diet is markedly diminished with respect to a number of other important nutrients in our food supply. And if you look at this overall, then we have a modern environment, including herbicides, pesticides, antibiotics, a poor diet generally, and a marked reduction in omega-3 fatty acids, which leads to an altered physiology in the brain, which makes the brain, in effect, more sensitive to injury, in fact, less resilient, which has resulted in an increased rate of concussion. So what are the issues related to this diminished brain resilience? When you alter the physiology of the brain by these various modalities, be it fatty acids or other vitamins and minerals, you interrupt the brain's ability to respond to injury. A deficiency in DHA, a specific neuroessential fatty acid, has, at least from the fatty acid side of this picture, been linked to this diminished brain resilience syndrome. A lot of recent research has also highlighted a number of other nutritional factors, including a number of micronutrients that we know profoundly affect the brain's ability to respond to injury, its cognitive performance, and subsequent neurodegeneration. The brain needs a lot of things to keep functioning at a normal level. Most of those elements that it needs comes from diet. Many of those items cannot be created by the human body, but have to come from diet. It's been said that most people today are not underfed. Certainly our athletes are not, but at the same time, even though they are not underfed, they may be significantly malnourished with respect to certain issues. A healthy diet 50 years ago had an omega-6-3 ratio of 4 to 1. Today, in a more typical diet today, that has shifted to about 22 to 1. And these omega-3s, basically DHA and EPA, has been looked at for a number of years relative to cardiovascular health, not so much with respect to brain health, although recent data now has emphasized at least one of those, DHA, to be really important as a neuroprotective agent in the brain. DHA is the most prevalent omega-3 in the brain, and it's really important in a number of things, including a major role in an anti-inflammatory aspect. And it's been well demonstrated now that having available appropriate amounts of DHA significantly improves brain resilience. And we'll show some studies that validate that in a minute. So what are healthy levels of DHA in a human being? There are tests that you can do that define what those percentages are. It's been looked at in a few studies. There was one study looked at 24 elite summer athletes. These were athletes in the Spain Olympic Training Center. And we know that omega-3, especially DHA, primarily comes from deep water fish. And the Spaniards tend to have a much higher incidence of fish in their diet than most of us do. Yet in this study, 23 out of 24 athletes fell below the ideal level of at least 8%. And at the same time, a similar study done in elite German winter endurance athletes looked at 106 athletes, and all but one of those fell below a normal level of DHA in their bloodstream. A really important study was published a couple of years ago. Many of you, I'm sure, are familiar with it. I call it the TCU study. Some call it the Oliver study, who was the principal investigator. But this study looked at DHA to define whether or not it had a neuroprotective effect. And they looked at 81 Division I football players. This was at TCU. And they measured a biomarker, the neurofilament light. Unfortunately, the acronym NFL is interesting, but has nothing to do with the league. But this is an important biomarker that measures the amount of trauma or injury occurring in or about the brain. These athletes had NFL levels measured on them throughout the season. They were given an algae-based DHA in various quantities. One group got 2 grams a day, another 4, another 6, and another had a placebo. And then they monitored these levels throughout the course of the season. And they found that 2 grams a day had the most profound effect, regardless of the size of the athlete. And that as the season went on, the NFL protein levels in the bloodstream went up, as one might expect, but it was most profoundly reduced by those who were getting 2 grams of DHA a day, and reduced the levels of NFL protein in the blood by almost 100%. And so we learned from that there is at least one fatty acid that has profound neuroprotective effects, and that's DHA. There are other toxins in the environment that are important, other micronutrients, other issues that affect gut flora. And so one might ask, well, is DHA enough in terms of addressing the issue of diminished brain resilience? This is a list. I'm not going to go into great detail on each one of these because it's kind of boring. There is a white paper that will be available to anybody who wants it, that goes into the weeds on each one of these, but I'll quickly address them one by one. I think the bottom line is each one of these elements independently has bona fide published data demonstrating its efficacy with respect to neuroprotection. Forte Elements, as was mentioned by Angela, is a company that develops products consistent with what's defined as the metaceutical concept or principle, in that it develops products that are defined to address a specific medical condition. And the elements in that product are based on published data. So everything in the product we know in this particular product has good bona fide evidence to show that independently it is neuroprotective in this case. In other products like the fracture product, the elements in that product are all known to contribute to more rapid fracture healing. So consistent with that principle, Forte Elements has included these items because of their independently demonstrated efficacy functioning as a neuroprotective element. Vitamin A is real important in cell-to-cell signaling. Vitamin C, interestingly, the highest concentration of vitamin C in the body is in the brain. Very, very important and as a neuroprotective agent. And if you preload a lab animal or a human with vitamin C and sustain a brain injury, that brain injury severity is markedly mitigated because of the presence of vitamin C. Vitamin D improves cognition and mood. I can tell you that the average North American, about 70% of most North Americans will be profoundly deficient in vitamin D if you were to test them. You can safely assume that many of your athletes are already deficient in that area. Vitamin E really represents a group of about 8 different antioxidants that improve cognition and brain function and are extremely neuroprotective. Likewise, vitamin K, similarly, neuroprotective and anti-inflammatory effects. B6 is an important neurotransmitter, and we know that if you're deficient in B6, you have greater frequency of depression, anxiety, sleep disorders, and cognition problems, many of which occur after concussion. B1 or thiamine is extremely neuroprotective. We also know that if you're a high demand athlete and under extreme physical stress, that your B1 or thiamine levels tend to go very, very low as a result of that physical stress. And so if you aren't B1 deficient today, you will be if you're working out hard on a regular basis. Folic acid, important in cognition and depression and neurodegeneration. B12, equally important in the brain in inflammation. It works well with folic acid. Some of these vitamins work together. Calcium, important in electrical signaling in the brain. Boron, a trace element you probably don't talk about very much, but it's extremely important in neuroprotection. Magnesium, a lot of people are aware that that's important as a neuroprotective agent, and it is. If you have a brain injury and you measure serum magnesium levels, your magnesium levels plummet right after that injury. And we know that it is likewise an important anti-inflammatory. And so having adequate levels of magnesium on board helps fill the void that's created as a result of the trauma that occurred. And last of all, zinc, it's independently, it's a neuroprotective agent, but it is also a very important cofactor in working with a number of the other vitamins. So can we make a difference with respect to brain resilience? It's interesting as athletic trainers, I know many of you listening in fill that role, or as an athlete listening in, you practice your skills, you condition your muscles, you improve your endurance, you work to improve your agility, you wear proper equipment. But we need to consider improving brain resilience through those things that are available to us. And right now, there's an abundant amount of data, information that demonstrate that we can improve brain resilience through nutritional support. This is what Forte Elements Brain Protect product looks like. It includes everything we've been talking about, 2 grams of DHA, algae derived. All of the neuroprotective elements that we were talking about comes in a single packet. So it's a pretty simple delivery model. You pound a pack of these pills once a day to initiate improving your brain resilience. You might ask, do my athletes have a medical need for DHA or these neuroprotective vitamins? Do they need this? Certainly based on current published data, one would conclude that probably all of them do, or most of them do. But if you want to get a little deeper into the weeds, there's a simple omega-3 test one can do, and Forte Elements can make that available in a very cost-effective fashion so that you can test your athletes. The tests are often reimbursable through primary or secondary insurance. And of course, if your athlete is deficient, which we expect most of them will be, managing them or treating that deficiency likewise is a reimbursable event from third-party payers. Blood test is a finger stick, goes on a special piece of paper, it's mailed in comes back in a couple of weeks to the athletic trainer or whomever else in your system is collecting that data. Interestingly, BYU's in the final stages of an IRB where BYU is looking at football and soccer athletes, prospectively testing one omega-3 testing, as I just indicated, and then supplementing these athletes with Forte's Brain Protect. And then going forward, randomly, about 10% of athletes are going to be checked their DHA levels, actually their complete fatty acid profile. Every month, about 10% will be tested. And then at 4 months, everybody's going to be tested again. Why 4 months? The available data suggests that it takes probably 4 months to get your DHA levels up to where you would like them to be. Now, we'd like to validate whether or not that indeed is occurring and whether it is variable from person to person. I know BYU is probably going to be doing a parallel study looking at DNA testing in conjunction with these fatty acid profiles. There's a lot out there to be learned. You as an entity can participate in this IRB if you wish. Dr. Brett Mortensen is principal investigator, and he could be reached, and the IRB is structured such that it can be expanded to include other entities and universities. From my perspective, it would be great if we had a group of athletes rather than 30 or 20 or 81, as was in the TCU study, but several thousand, where we could actually draw some more profound conclusions about the impact. Go back to that one more. In this study, as going forward, in addition to measuring the blood levels, we will be collecting the other data that we routinely collect. Preseason cognitive testing, sway data, and then other data as it evolves. You might ask, what do you do in this study if you have an athlete who actually has a brain injury, a concussion, a bell ringer, or some other defined brain injury? At that point, we would recommend you continue to take that base product and that you supplement it with an additional 2 grams of DHA a day, probably for a month or until everything has resolved. Interestingly, when you look at the big question of how do you treat a concussion, you'll quickly conclude that nobody really seems to know how to do that. We've consulted neurosurgeons and others, just reviewing the Collins Clinic recommendations. You can see that the focus right now at the academic level is defining the different types of concussions that exist, but nobody seems to have come up with any specific recommendations from a medical perspective as how to medically manage a concussion or what one might do to facilitate recovery. Given what we know about nutrition, if we can improve the quality of the brain's nutritional status prior to injury, we should be able to minimize or mitigate the amount of trauma that occurs. And by continuing to provide the brain with those nutritional elements that we know it needs, one would assume that that would facilitate recovery, certainly put it in a better position to recover than if it was lacking in those important micronutrients. What are the NC2A concerns about this whole issue? Well, we all know there are banned substances. We know there are impermissible substances. The components in both of these categories, however, are superseded by actions taken by a treating physician. For example, if you have an athlete who has hypogonadism, it's perfectly appropriate for you to prescribe androgenic steroids to that individual. Is that a banned substance? Of course it is. Is it appropriate and is it banned in that situation? Of course not. You're treating a medical condition. Sometimes androgenic steroids are important in the multiple trauma victim to facilitate recovery, not to augment performance in a performing athlete, of course, but in the treating a medically defined condition, especially off season. In this particular application, defining a fatty acid deficiency, as one might expect given the data that we have, as you test your athletes and you define them to be deficient in omega-3s, and other vitamin deficiencies. If you wish to test, then it's certainly appropriate for your physician to recommend supplementing those athletes with an appropriate product to mitigate or treat that defined medical condition. So I've been talking a lot. We've had a number of questions come in while I've been chatting. Take a moment if you have another question that you want me to look at. I'm happy to address it. Let me start with some of those that we've already received, and I'll walk through those. Okay. Good question. So I talked a lot about DHA and other vitamins and minerals. What about EPA? That's another omega-3 fatty acid. EPA is not in the Forte product, and the reason it isn't there is, again, sticking to that metaceutical principle. EPA has not yet been defined to have a specific neuroprotective effect. It's an important fatty acid. There are lots of things that are important in your diet, and one might add that, but it has not been defined or substantiated to be specifically neuroprotective. And this product is defined specifically by that agenda, to put everything in that bucket that we know is neuroprotective. Now, it wouldn't hurt to add EPA to your product. It would make your product more expensive. It would add a couple more pills to a product that is already a handful of pills. And so that's why you don't find it in the Forte Elements Brain Protect product. Will it help prevent concussions? Boy, I certainly hope so. But from a medical perspective, we don't have any data to be able to support that or make that claim. If we go back to the TCU study, that's probably the most valid and really landmark data that we can look at. They in that study did not look at the frequency of concussion. Their biomarker was the NFL protein in the bloodstream. What is that in simple terms? Basically, they're little pieces of axon or little pieces of brain, if you will, that end up in your bloodstream, secondary to micro trauma or repetitive trauma or major trauma that may occur in the course of banging heads in football or some other sport. They did demonstrate that they substantially reduced the amount of that biomarker. One would conclude from that the amount of damage to the brain was significantly diminished as a result of that brain being fed neuroprotective elements. Oh, yeah. So somebody wants to know if you can raise your athletes' omega-3 or specifically DHA levels with diet alone. Good luck with that one. That would be, but it'd be worth a try. I think the data out of the Spanish athletes would kind of tell you no. If you look at food sources that contain DHA, the reason we're always talking about DHA with respect to fish oil is that DHA, by and large, with the exception of walnuts, you can find it in walnut oil and certain other plants, most available DHA is made by algae. Algae in the ocean tend to be eaten by crustaceans who then are eaten by little fish or eaten by big fish. Catch the big fish, squeeze it hard enough, you get fish oil out of it, which contains a number of things, including DHA and EPA. So for a natural source in your diet, the best place to find it is by eating a lot of fish. Having said that, the data so far would suggest that diet alone would be a very difficult way to address this issue. But that'd be a great study for somebody to do and look at whether or not they could substantially impact the DHA levels in a competing athlete with a modified diet. Let's see, will the product decrease the recovery time post-concussion? Answer, I don't know. Again, coming back to the basic biology, one would think that it would. That if your brain is more resilient to injury, if your brain has the resources that it needs to recover from injury with respect to fatty acids and other micronutrients, if the storehouse is full, if the anti-inflammatory agents are there, then one would expect that the brain is in a better position not only to be resilient to injury, but also to recover from injury. In terms of human studies, there's very little out there that would answer that question. When you look at lab animal studies that have been done, the answer in most all of the elements that we referenced is yes, that by preloading animals with neuroprotective agents, exposing them to brain injury, and then monitoring the severity of the injury and the speed of recovery from the injury, those animals that have the appropriate resources to recover predictably get better faster than those who don't. But again, in terms of human application, not much data out there at this point. Okay, is this product NSF for sport certified? That's a good question. With respect to Forte Elements, that is currently pending, and shortly we'll have the final certification with respect to NSF for sport. Oh, good question. So if an athlete is deficient, and predictably we would expect 95+% of your athletes are, how long does it take to get them up to a normal level? Part of the IRB at BYU is looking at that and measuring that. The measurement from the bloodstream comes from red cells, and our data presently would suggest that when a red cell is made, it incorporates the amount of DHA that's available at the time that that red cell is produced in the bone marrow. And then that red cell runs a lifespan, which is typically about 120 days or 4 months. And so if you start providing the athlete with adequate DHA levels, we would expect that as red cells are created and older ones are retired, that gradually that level will increase until a period of time, probably 4 months, until that athlete's level would come up to the expected level. So probably takes about 4 months to get them where you would like them to be with respect to DHA. Now there's a dozen other key micronutrients that are similarly important as neuroprotective elements. And I think in many cases, the brain's ability to utilize those elements is going to be much, much faster than incorporating DHA into the system. What else have we got here? Okay, yeah, well, back to the NC2A issue. Because omega-3s, actually, if you look at your impermissibles list, it says fish oil. It doesn't actually say omega-3s. And so if you were to look at fish oils as a whole, you're really looking at DHA and EPA as derived from fish. There's a couple of ways of addressing that. One, the DHA used in the TCU study was algae derived. What's the advantage of that? Well, if your DHA is produced by algae, and these are algae that are farmed algae, somewhere they have little algae farms, I guess, and they produce the DHA, and they're not in the ocean environment. One of the concerns about fish oil products is because they come from the ocean, many of them are contaminated with mercury. And so an advantage of having an algae-derived DHA source, which unfortunately is more expensive than fish oil-derived, is that it's mercury-free. It's a vegan product in terms of it's plant-based. It actually is categorized as a food rather than a supplement because it is plant-based. But having said that, I think the key issue is that with respect to the impermissibles list is if you as team physician and athletic trainer define a medical condition, whether it be hypogonadism and you treat the athlete with androgenic steroids, or whether it be a fatty acid deficiency syndrome and you treat them with a algae derived or other derived fatty acid product to treat that medical condition, When you have the physician involved in the decision-making process, then that really removes you from the issues of banned substances and or impermissible substances, because now you're in the sector of medical treatment. And that's probably the most valid position to be in. Some have asked about other competing products. Probably the unique thing about the Forte Elements product is its delivery model. There are some products out there that are liquid based. And so one takes a tablespoon or whatever per day. But the challenge there is once you open the bottle, you've got to refrigerate the product. You've got to take care of it in that fashion. It's a little harder to take care of, harder to take on the road, harder to make sure that you take it on a daily basis. Whereas the Forte Elements product is just a simple pack of pills. You can throw the pack in your bag. You can take it on the road, take it home on weekends. And because of the simplicity of the product, it's more cost effective than it might otherwise be with some other products. I think we've run out of questions at this point. Thank you very much for your attention. I hope to talk to you again.
Awesome. Thanks, everyone, for joining. We'll make a copy of this available to anyone who requests it. I've got some contact information here at this last slide. The Brain Protect white papers and anything that you want to know about the product are also available in the handouts tab for you to print off. I wanted to let everybody know that we will be at NATA this year, just next week, and so I encourage you to meet us at our booth with Garrett and Jake. They'll both be there, and come by there. And I'd also like to encourage you to join us next month when we will have another webinar on fracture, and that's on July 27th, but there will be more information on that to come. So thanks again, and appreciate your time, and look forward to talking to you again soon.